Welcome back to TV5 News at 9. It's time now for Health Yes with Genesee Health Plan. Joining us now is Kimberly Van Slyke from the Genesee County Health Department. Thank you so much for being here.
Good morning.
So today we are talking about contact tracing. So first, tell us what contact tracing is.
So contact tracing, I feel like it's the buzzword of 2020. While this COVID thing is new, contact tracing really isn't. Contact tracing dates back to the 1800s, and it's really just the identification and contacting of those individuals who have been exposed to a disease or someone who is, in this case, positive for COVID-19.
So if someone gets a call that they've been exposed to COVID-19, should they get tested?
So the best case scenario is, and the best answer is yes, they should get tested. However, they need to not just run out and get tested. They need to either talk to the health department or talk to their healthcare provider and talk about when the best time to get tested is. Because if you're exposed today, you're not going to test positive today or tomorrow. You're probably not going to test positive for 4 or 5 or 8 or 9 days. Each type of disease process has a different incubation period. We've identified that COVID-19's incubation period is anywhere from 2 to 14 days. And so the most likely time that the virus is going to have built up enough in your system to test positive is going to be around between like day 5 and 8.
Okay. And so I have a question for you because I tested positive a few months ago, and one of the things that I was told on the phone by the county health department when they called me was that people are scared to call them back because they think it's a scam. Can you tell us a little bit about that?
Yeah, so and actually, unfortunately, people have been taking advantage of this terrible situation, and we have had people using our Genesee County ID as a scam phone. So that's been very difficult to deal with. However, if you get a call, currently the state of Michigan is coordinating all of the contact tracing for Genesee County and several other counties. And so if you're answering on a landline, you're actually going to see a caller ID that says MI COVID help. And if you're answering from a cell phone, it's going to be an 866 number. And if somebody's calling from the state or the county to do contact tracing with you, they're going to ask you to verify your name and date of birth so that we can make sure we're talking to the right person. We don't want to share information about you with somebody else. So they'll verify your name, your birth date. They'll want to verify your address in case they have to send any follow-up information. But they should never, ever ask for any personal, financial, tax information, your social security number, anything like that. And anytime that they're calling, if you call back the number that they called from, it should give you either a call back to the health department, the state of Michigan, or it'll give you a voice recording saying that this call was initiated from the My COVID helpline.
Wow, that is really good information to know. And what are some of the other myths and fears that people may have about contact tracing?
So some people really worry that that their contact and information is not secure. The calls are not recorded, and the information is not used for anything other than to follow up with them. When you get contacted because you and they're following you because you were exposed to somebody who's positive, they're going to want to talk to you for the entire time of your quarantine, which is usually 14 days. And they're going to call and check in with you every day to see how you're feeling, to see whether you've developed any symptoms, and to help give you guidance on who you should call if you do have symptoms. But we keep that information in a database at the state, and only people who work for the state, have been recruited by the state or by the county, have access to that information. It's not something that just anybody can log into and find.
And how is the Genesee Health Plan involved in this?
So Genesee Health Plan is one of our longtime partners at the Genesee County. They've been involved in several initiatives, including lots of immunization things, and now they're here involved with our case investigation. They have helped build a volunteer pool here in Genesee County. We're actually in the process of taking over the contact tracing piece from the state, and only because of our partners like Genesee Health Plan and the United Way and the Greater Flint Health Coalition, can we bring enough people in and get our volunteer group built up enough that we'll be able to handle this at a local level, so we have Genesee County people calling Genesee County people.
All right, thank you so much for joining us this morning. Is there anything else you'd like to add? Just to reassure that any of the information that's collected is safe, it's secured in that database, and the other ways that data might be used really is just primarily to get the education and the information out to individuals, and then we look at it as a group number without using the names. We look at how many contacts of how many cases we have, so we can make an estimate of how many volunteers we need to be able to reach everybody. Well, thank you so much for joining us this morning, Kimberly.
Thanks.
And if you would like any more information about today's topic, you can check out the hot links page on WNEM.com.